Hello, listeners. This is Michael O'Connell. I'm talking to you from the California Association of Healthcare Leaders. And this is our podcast to be able to talk about the authentic leader. And for those of you that may not be aware, we are an independent chapter for the Northern and Central California region, and that we do serve healthcare executives in 50 of California's 58 counties. And our vision is to be the premier professional society for healthcare leaders in our region, advancing healthcare excellence and healthcare leadership, and improving the lives of the communities we serve. And this is the beginning of our podcast series, and it's really meant to provide some thought leadership on numerous healthcare topics from our CAHL members and our allies. And so today we welcome Nick Drews, who is the director of the County of San Luis Obispo Health Agency. Nick oversees the planning and development and implementation of health services, including health administration, public health, mental health, drug and alcohol services, animal services, and the Office of Public Guardian. And they have about 800 employees and a budget of about $150 million. And he's served with the health agency since 2015. And he's been deputy director in charge of administrative services as logistics chief during the COVID pandemic. Wow. And as a site manager responsible for building the Cal Poly alternate care site. Prior to this, he was a senior consultant and then manager at Deloitte Consulting, serving several Fortune 500 companies in work related to change management and organizational effectiveness. He does have an MBA from the University of Southern California, and he does reside in San Luis Obispo with his wife and 2 children. So Nick, wanted to welcome you today.
Well, thank you for having me.
So Nick, this is on authentic leadership, and you've had some really interesting career experiences at Deloitte and working with Fortune 500 companies and working in a predominantly agricultural mecca within California. And when you hear the word authentic leadership, what does that mean to you, and what does that mean in terms of your career?
Well, I think it's as simple as really just being honest, demonstrating integrity in your actions, and doing the things that you say you are going to do. Um, uh, I think one of the little bit of ironies is that how do you become an authentic leader? Because if you try to be authentic, you are no longer being authentic because you're doing something you're not. So there is a little bit of a task there in how you can achieve this goal while still being honest in the attempt.
Oh, so talk a little bit more about that in terms of being authentic, but then not being authentic. When you work in organizations, there may be certain things that you're asked to do that you don't necessarily feel comfortable with, but then you feel that you still need to do it. And so talk through that. Give us an example of a personal experience where your authenticity as a healthcare leader either made a significant impact on your team, the organization, or where you struggled to be an authentic leader during a time of crisis or challenge.
Sure. Well, I think it really goes back to setting the framework for yourself. Similar to within a business, we have our goals, our objectives, our vision, our strategy. Here at the health agency, we have a mission statement, and we have 5 different visions that we follow. One of them is I'm going a little bit off topic here, but I try to get wrap
No,
around.
it's all connected, Nick. It's all connected to how do we serve as effective leaders.
And it's there's this I one of our values is compassion.
Okay.
And I often talk about compassion as not something that you just necessarily have, but something that you continuously have to work toward. So you have to continue, and in healthcare, this is something that's very important. We can't do what we do unless we see ourselves some way, or we can somehow empathize with the individuals that we're working with, especially in the public sector, which I'm in, where we're dealing with some of the individuals that are kind of have the biggest challenges or have been left aside by society. And so we have to help that broad array of individuals. And so compassion is something that I think we often will work toward in trying to make sure that we're seeing the world through other people's eyes. We're working and if you can build those values, those core sets of values within yourself, the person that you think you are, that you want to continually become, when you need to get into that next position where you're making a decision, where you're making even a challenging decision, you've already created your own set of values and beliefs, and that they can shape you and the decisions that you make so that you are then doing the thing that is authentic for yourself. There have been a variety of different, situations that have been very challenging. I think one of them has been sometimes employee terminations. I've had
Sure.
issues where I've had to terminate an employee that I've known for a long time,
Mhm.
that you felt personal connections with,
Yeah.
and 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 sometimes the other people within the organization have a connection with,
Yeah.
and you're going to walk away from that leaving an impact on the organization to say, did you do the right thing? Were you fair? How can you do that to such an individual?
Right.
And those are ones in which I always just ask myself, am I doing the right thing?
Sure.
And if I can walk away from it, I might lose sleep at night because of it. But as long as I know I'm doing the right thing, I feel like I can make those challenging decisions because I've already established a set of core values for myself.
I know, Nick, myself, that when I had terminated an employee, the one time an employee actually thanked me because they said that I did it with respect and with compassion and treated them like an individual. And it sounds like in your situation, you were doing the same thing. That while they may have not necessarily thanked you, that you did it where you respected that individual and you did it with compassion.
I think we always hope so. And there's no doubt that there's going to be issues that arise from it sometimes. I'm thinking of one case in which, there's still a group within the community, our organization that they're still not quite whole, but it doesn't mean the things that you do aren't without consequences, but you're doing them because they're the right thing to do,
Mhm.
that they're the right thing for the organization, they're the right thing for our patients. And uh, it's the tough thing about the job sometimes.
So how do you, as you look at that value of compassion, or as you talk about authenticity, that may be something that isn't well understood by a certain individual or by a certain group of employees. How do you how do you teach or how do you help those individuals to understand this is what compassion looks like, or this is what authenticity looks like?
Well, I think it goes back to the idea of why we do what we do. So we have the luxury of being in a line of work where we get to make the world a better place.
Mhm.
You were reading my bio, and I used to do consulting, and I used to work for tech companies, Fortune 500 companies, where really the aim was, you could call it all sorts of things, but it's making money. It's selling beanie babies. And one thing I realized when I got into this line of work within healthcare was how much making a difference mattered to me.
Mhm.
Might not have realized that at the time, but it wasn't until I really started doing this that I realized, waking up and knowing that there are individuals whose lives are improved because of what I've done or what my organization has done. That's important. And so I talk a lot with my staff about connecting to that, connecting to that reason or rationale for why we do what we do. And in fact, especially being in the public sector, this isn't the place you go to make your fortune. You come here and you work in our behavioral health clinics that are dealing with severe mental illness. You deal with some of the farm workers in our community. You do that because you feel like you're making an impact. And if you're not feeling that impact, this probably isn't the right line of work for you. But because of that, um, that means that when we do what we do, if we can always go back to that rationale, we can always, I think, move forward with the right intention and the right goals, and we're always doing things for the right. Once again, to say it, for the right reasons. And so that's what I think, especially being in healthcare, it's something that we can tap into, and maybe ways that someone of a Fortune 500 company of Pillsbury, for instance, is saying, how do I convince everybody that we're all here for the best cause to make muffins? That might be a little bit harder, and it might be a little bit harder to be authentic in a situation like that. It's not for us because we have real good reason to be authentic because we're doing good things.
Mhm.
And so it's tapping into that. And I talk to my staff about it. Find that passion, remember why we're here, and utilize that in everything that you do.
So are there certain things that you do within your organization to be able to reinforce those, town halls or staff meetings, or you review a value of the month or something so that people can see, as you talk about compassion as one of your values, as well as others, that people can really see that this organization is living its values?
Yeah, I think so. I think you always have to really connect the organization back to that value. And there are a variety of ways to do that. I think communication is key because there are some of the people within our organizations that are going to see it a little bit more immediately. So, for instance, if you have a nurse in an ER, they're next to that client. That I mean, that we call them clients sometimes in behavioral health, but with the patients in the ER every single day. So they're feeling that connection. Someone in accounting, someone that's with the mop in the bathroom, might not have that same connection. But you know what? It takes us all. It takes every single one of us to make this shit work. And every single person has a connection. And so one of the things we'll often do is I'll have individuals either that are frontline talk to the people that are maybe in the clerical positions, and when they do talk, to bring in stories about how maybe when you helped us out with that financial issue, with that invoice, and you did it in this type of a way, that made these people happy, or it improved the outcome in some sort of way, so that we can connect the non-line workers with the line workers. And I think this story is consistently coming backwards and telling how everything that you've done, even in IT, how it's mattered. As you consistently reinforcing that has been valuable for our team. And I would say, because I give you a good example as to why I think it's worked. 5 years ago, we did an engagement survey for our organization, and
Mhm.
that was one of the questions was do you feel that your work matters?
Mhm.
And we recently did it again, and it's gone up. And so these are what you can measure it too. So go ahead and measure it and see if what you're saying actually starts to resonate. But I do think telling those stories, bringing in that connection point, it'll help.
So what I'm hearing is that when you did the employee engagement survey 5 years ago, and then you did it recently and it went up, that there were interventions or changes in the way that the organization worked with the employees so that it did go up. So are there specific things that you can look back and say it's because we did A, B, C, D, and E that that this went up, that there's certain things that we've built into our standard work or our daily workflow that have stuck, that they become habits that maybe they weren't before?
Gosh, I hope so. I hope these are the reasons. It's always hard to say what they are, but I'll tell you, there are little things sometimes. I've even just started to recraft how I communicate. So when I always say team, hello team, whenever I send out an email once a month that talks about what we've accomplished, what we're going to be doing, just says thank you. It was Christmas time, it was the holidays, And there were a number of you that got to celebrate, a number of you who had to come into work. Just thank you to those who came into work. But I send out emails along those lines, and it's always team, using words like we, using words like team. I think though that has resonated, just those little things. And also the idea of communicating and not just leaving it empty, because these communications that are happening always loop back into that fundamental idea of we're here for a reason. Remember that what we're doing matters, and what you are doing matters. And I think just not doing it every once in a while, but consistently every month, reaching out and making sure it's a part of our internal communication. I think that's one of the big keys.
So your organization and many others post-pandemic have really struggled with everything from financial viability to access to resources, to employee turnover, to struggling with burnout and many other kinds of things. The American College of Healthcare Executives did a survey of different healthcare leaders to be able to find out what are some of the top issues that are concerned for them. And burnout was one, as well as challenges in meeting their finances with fewer resources. How has any of that resonated with you and your organization, and/or how have you, as an authentic leader, been able to work through some of those challenges with your team?
I agree, all of the above. There's been, it feels like when we have fewer applicants coming in, so it's harder to fill positions. We have higher vacancy rates than we used to have. We definitely have a lot of stress within the organization. Going through the pandemic was difficult. There were a lot of individuals that worked really hard and never really got the true appreciation that I think they really deserved. And sometimes I was talking with someone the other day who said, yeah, I did all this work during the pandemic. I don't tell anybody about it, because they said, why would you waste your time with all of that? So there's also this negative element within our society. Well, that was a waste of time. At least that's from some people's perspective. And so it takes its toll. If you spend all of this time, all these hours, and no one says thank you, no one appreciates what you're doing, it's hit our whole industry.
Mhm.
So what we do about it, I think we've looked to alternative methods of, we've looked to our scheduling, seeing if there were opportunities to restructure some of our schedules. Sometimes it's easier than others depending on the positions, but maybe not necessarily working 5 days a week, going to 4 days a week.
Sure, like 4 10s instead of 5 8s. Yeah.
And for some positions, even we do a lot more remote work than we used to,
Sure.
which allows a little bit of flexibility in the afternoons for maybe a younger parent that needs to pick up their kids. Then they'll come back at 7 and get online again.
Right.
But it gives you that flexibility. So we've really just been trying to leverage all of the different tools that are available with that goal, that intent of trying to release some of these challenges and tensions that are occurring within the staff.
Are there certain things that, if you had to do it over again during the pandemic, that you would have done something differently?
I don't think so. I think it was done well. I think it was done right.
Or can you share an example of a challenging situation where your authenticity played a crucial role in your decision making as a healthcare leader?
Yeah. So sometimes you have to choose your words wisely, or your stories and your anecdotes. But
Sure.
so being public health health agency for a county, we were really very much on the front lines uh, of the testing and
Yeah,
the the injections. I'm sorry, can't remember. My mind's
yeah,
going blank at the moment. But we were on the very much on the front line, and I think we were. It wasn't necessarily all my decision. We had a lot of there was a lot above us that was forced
right. Sure.
these
And
decisions.
that's the case in whether it's counties or in other organizations as well, is that there's certain individuals that have power and influence to be able to say, this is what we're going to do, even though people don't necessarily support those actions, but they still have to do it.
Exactly, and I think that was probably the biggest challenge was all of this level of pressure and stress, making sure that we had the right number of supplies available, that we were getting the PPE in, despite the fact that the ships were stranded off of the coast of India, that
Right,
the respirators were coming in, that the vaccines were on time, that we had the right refrigeration units and freezers for whether it was going to be Moderna or whether it was going to be Pfizer.
right,
All of this was causing an enormous amount of stress on the individuals on my team that were trying to do all of the things that they needed to do. And so I think if there was something I could do differently, it would have been maybe not place the level of stress on them that was being pushed down upon us. But that's not something that we could have controlled that was above us.
right. Sometimes you don't have, especially in a pandemic, you don't have time to think. And that what happens at 8 in the morning may be different than what's going to happen at 2 o'clock in the afternoon, because things are changing very quickly. And the importance of keeping knowing that you have their back is what I'm hearing from you, Nick, is that it's important that people know that you have their back, that you support them, that you have compassion, that you care for them, and that we have hard work to do, and we're here to be able to support each other and do everything we can, that you have the resources and the tools and the things that you need so that you can be effective in your job.
Yeah, there's a phrase, and I'll take the French out of it, but when there's that feces rolls downhill, and I think one of the goals I tried to do, and I think good managers do, is that you try to stop it. You try to pause it so that it doesn't keep on rolling. And so you can protect your staff and you can protect your team so you can make sure that they're doing what they need to do.
Yeah, I say that I want to make sure that I'm there to break down the barriers or the roadblocks that prevent them from being successful in terms of performing their jobs. And it sounds like that's what you're talking about as well.
Yes, I would say so.
So let's wrap this up with we have a lot of people in CAHL. We have 1,600 members in 50 different counties and coming from all different walks of life. And what words of wisdom or advice would you give to our listeners of some things that they should consider or think about in terms of being an authentic leader? And then we'll wrap up.
I think it's really just building out your own core set of values and making sure that you understand what they are, understand why you do the things you do, why you wake up in the morning, and then go full in on that. That's what matters. That's what's going to shape you. And leverage CAHL, leverage these organizations that we have around. Learn more. Reach out to other people, see how they do the things that they do. They're great organizations, and the more that you can connect, I think the better off you're going to be.
Well, Nick, the county is very fortunate to have someone with your expertise and your background and your experience to be able to work there. And sounds like you're born and raised in the community, and you left to be able to work outside, and you came back. So the hometown boy came back home, and the county's benefiting from it. So
I
it's
love it here, San Luis Obispo.
Yeah.
We're always looking
Well,
for great
and
talent.
and I'm also thinking that maybe you want to keep it quiet, that you don't want to, you want some people, but not too many people, that you want to maintain the specialness that the county and the city has for you. So I
Anyone
wanted to,
listening to this podcast, I'm pretty darn sure is good people. We'll take you. A lot
okay.
of positions available too, if anyone's looking to hire.
So Nick, I wanted to thank you for participating, and our CAHL listeners. Thank you, and continue to listen to other leaders that will be sharing their perspectives on being an authentic leader.
Recording